right, thank you very much, Tucker. The holiday season is a prime time, of course, to reconnect with family members. It can also serve as a way to fill in the blanks of your family's health history. That might have a big impact on your future health. Joining us now to explain is Dr. Assil Saleh with Foxhall Internists in Washington, D.C. Thanks for coming in. Nice to see you.
My pleasure.
Nice to meet you.
Thank you for having me.
So here's this is what I understand. My understanding is that when you've got the family together, this is a good time to kind of quiz them about family medical history. So
That's exactly right, Tony. That's exactly right. The idea, and actually this is an initiative that was put together by the Surgeons General. Right. Back in 2004, they actually declared Thanksgiving Day or Thanksgiving time to be the National Family History Day, because people get together. They gather around, celebrate the festivities, but this is a great time for all of us to be talking about our medical issues, medical problems, to assess our risk in the future for developing such problems.
Now, theoretically, that sounds sensible because you've got everybody gathered there, but how do you initiate that conversation? Because sometimes, you know, family members, sometimes older family members, they don't really want to get into all of that. Why is it important to initiate that conversation?
You're absolutely right. First of all, it's important for us to explain the reason behind our questioning. And we're not trying to intrude into their privacy, but it's actually for our own personal benefit to try and find out about their medical problems. It is important to let them know that this will further stratify us into risk categories for certain medical conditions. For instance, heart disease. So if there's a first-generation family history of heart disease, whether heart attack, whether risk factors for heart disease, that would put me at risk for developing heart disease in the future, and that would make my doctors be more aware of my risk category and then either test me sooner rather than later, or look at different testing modalities and so on.
I think it's interesting because I'm sure some families this knowledge is readily available, but in some cultures, you know, people don't like to talk about what their issues may be, and frequently it can impact you directly, especially if it's something that is hereditary, sickle cell anemia, things like that.
Absolutely. And you know, diseases are interesting. They're a product of the overlap of environmental factors, genetic factors, behavioral factors, and so on. And we all live in an environment where we share those behaviors, and it's really important for us to know about these risks.
There's a website, it's familyhistory.hhs.gov that has a form that people can fill out, and that provides some guidance on doing this. Here's a question. A lot of people are going to say, I don't want to be filling out a form online with all my medical history.
This is purely private. Okay. It is your own, it's my family portrait, and very private. It will not be shared, and it will be confidential. So go ahead and go look at it, and it's very important. I mean, I think that a look into one's past or family history will predict their future health. So, and will really help their healthcare providers to stratify them. So, for instance, breast cancer. If someone had a first-degree relative with breast cancer, how old were they when they were diagnosed with breast cancer? That would make me, as a healthcare provider, think about this and advise them to get testing at a younger age, at shorter time frames, and so on. So, same for colon cancer, same for heart disease, genetic conditions,
hypertension, all that,
exactly. Genetic conditions, like you mentioned, cystic fibrosis and sickle cell and so on. Those are rare. However, if I know about them as a healthcare provider, I will be more aware of them. I will be testing the patient. I will be testing their or potentially recommending testing for their family members, their children, and so on.
Bottom line, the more information we have, the more information we can give our doctors, and the whole situation is more helpful. Doctor, thank you very much for coming in.
Thank you so much for having me.
I mentioned the website, familyhistory.hhs.gov. It's a mouthful. Go to our website, myfoxdc.com. We will link you to that website, and you can see the form there and get all of the information and the like. Thank you very much.
Thank you so much.
Good to see you. Allison, back to you.
9:39 right now.